Hello everyone. Welcome back to Empowerment in Illness. I am your host Gwen. In our last episode, I spoke with Dr. Ben Gollier. Dr. Ben is the founder and CEO of F8 Well Centers and the Gollier Method. Let's listen to part 2, already in progress. Yes, and when someone brand new comes in, you're feeling just horrible. And you're telling the doctor your symptoms. He says, we'll do some tests. They say you have lupus, give you medication.
Sure.
Where's the advocacy? How do I know? I'm brand new, I'm scared because I'm sick, and I don't know what to do. And I'm going to them because you have a PhD, so I think you went to, like you said, lupus school. You could help, but you're giving me medication after medication. I'm not understanding, but I'm just following your lead because I'm putting my faith in you. Where's the advocacy? Where does it start? Is there ever going to be where a doctor will say, I'm going to diagnose you with lupus, but to clear your mind, why don't you go get a second opinion? Does that ever happen?
Here's what happens with my mom's MS. It was the same thing. We go, well, we never really knew much about MS except that her cousin had MS, and so dang, I don't want her to be in a wheelchair all the time. And so, my dad would take her to the neurologist and whoever, and they're like, well, here's the latest. Get on this MS drug. You'll still have flare-ups, and it'll go to remission, and it'll get worse, and it'll just keep going back and forth, and then it'll eventually kill you. Okay, well, that's not really promising. Again, we didn't know any better. Unfortunately, my dad retired. They moved down to this little town in the middle of nowhere on the Missouri-Arkansas border, and they got referred from a friend to this doctor that did, back in the 90s, some weird stuff and talking about gut and talking about brain and blood sugar and all these different things. He was able to help her body heal by helping each and every one of these systems and calming it down. And here's what I always tell people. One, you're asking the wrong questions. When you saw ANA high the first time, what's one of the first, and you or anybody, what's one of the first questions people ask?
What is it?
What is it? What do I have? What autoimmune is it? And then they say, what do I take? What did you ask me?
What's the cure?
What's the cure? So you asked the wrong question. You asked the what question. I didn't yell at you, but I could have. I've yelled at people before. It's the what question that is the wrong question. Because what, if your ANA is high, I'll do videos of people, I don't know if they get mad at me or not, but I'll say, I don't care what autoimmune disease you have. Obviously I care, I love you, and I don't want you to have autoimmune. But ultimately I don't care because I'm not going to treat the autoimmune condition somebody has. If somebody has lupus or they have Sjogren's, it's the same thing for that person. It's going to be different person to person, but that same person, if they have a viral infection, we got to deal with the chronic viral infection. If they have chronic bacterial infection, we got to deal with chronic bacterial infection. If they've got high blood sugar or low blood sugar, or their blood sugar goes high and low, or if they've got leaky gut, or if their liver's not detoxifying, or if they have a high estrogen or low estrogen, or high adrenals or low adrenals, whatever it is, that's what we've got to work on. And that's what I care about. So instead of asking, what is it? What do I take? What's the cure? You ask, why? Why in the world would my body be attacking itself? That's weird, right? I don't know about you, but I believe God designed us to be pretty optimally functioning creatures. And when we do enough of the bad stuff and don't do enough of the good stuff, our bodies can go haywire. So then we say, okay, why in the world would my body attack its own tissue? That just does not make sense.
Not at all.
Yeah, and not like just one random person, but like the majority of the U.S. population has autoimmune. It's crazy. So why is my body attacking itself? That's the question you need to be asking. Not what do I take? What's the cure? What disease is it? Because then, great, now we know what disease it is. Here's the magic drug. And we all know that the magic drug ain't going to fix it. So then we say, why? Why is this happening? Well, okay, now that's when I draw the circle and the lines coming off there and kind of the spokes. And then we say, well, guess what? Your blood sugar's spiking up. Every time you get this insulin surge, when your blood sugar spikes up, that insulin surge drives cytokine activity and you rev up that immune system and then you start destroying more tissue. Every time your blood sugar crashes down, your adrenals kick in, kick out cortisol. You rev up that adrenal response, but then it also stimulates the cytokine activity. If you have leaky gut in your small intestine, intestinal permeability, things are getting into the bloodstream too early. It's stimulating this immune response, stimulating your cytokines. You're destroying more tissue. If you have Hashimoto's or other autoimmune, but especially Hashimoto's, every time somebody eats gluten, it's going to stimulate that cytokine response, not for a day, a week, a month, but for up to 6 months every time somebody ingests it. If your vitamin D is lower, if you have autoimmune and your vitamin D is not 80, you're not modulating that cytokine response, and you're going to be revving it up and destroying more tissue. If you have a chronic infection, whether that's Epstein-Barr virus or any other type of virus, or you've got chronic H. pylori in your gut or some type of microbiome imbalance, you're going to be driving this immune response every single day, 24/7, and it's going to stimulate cytokine activity, and you're going to destroy more tissue. So those are some of the whys that you need to be asking about. So don't ask what, ask why, and then you're asking the wrong who. And this is why I always say, an endocrinologist would be the worst job in the world, because they see these Hashimoto's patients that have thyroid issues. The patient comes in, they're feeling bad, and they go, oh, your numbers are fine, and they don't change anything. Or they go in and go, oh, your numbers are off, and I'm going to raise it a little bit, lower it a little bit, raise it a little bit, lower it a little bit. But nobody ever feels better. And so, horrible job to do. But the wrong who is who most people are going to, because they're expecting some type of miracle, some type of change, them to know why this is happening. But all they have in their tool belt is a hammer. And yet there's a screw there, there's a tack over here, and if you sledgehammer it, it's going to blow up. You got to have the different tools for the different things. And so they've got one tool, give them that drug. What'd you go on? You went on hydroxychloroquine?
Right now I'm on Plaquenil and Prednisone.
What?
Those are the ones.
Yeah.
But I've been on these for 31 years.
Prednisone, your adrenals are shot.
Yes.
Absolutely. If we ran your cortisol and DHEA, they would be non-existent. So you're on a steroid forever. But you started out with the wrong who. And this is a really important part of your question. I don't mean to be a Debbie Downer for people, but when you were saying, how can we advocate for ourselves? But the question is, to advocate to what? Because the only option when you go into that rheumatologist is they're going to give you Plaquenil, they're going to give you steroids, they're going to give you, maybe an infusion, some type of drug that does nothing to stabilize your blood sugar, that does nothing to get your vitamin D optimized, that does nothing to fix your leaky gut, that does nothing for the chronic infection going on in your body. A lot of my patients, their white blood cell count is already low when they've got autoimmune, and then they go on immunosuppressant, and it even suppresses it more. Unfortunately, until there's a seismic shift in how we go about thinking about this and who gets referred to and who, when functional medicine can really play a role in the everyday life of the autoimmune patient, we're going to be this afterthought that once somebody has failed with their rheumatologist or neurologist or endocrinologist or like you, 31 years, and finally it's like, okay, this is not working. I've been banging my head against the wall for all this time. I'm going to look outside the box. As long as we're still outside the box, we're going to only get people usually at the end stage of, okay, they've already tried a few other things and it's just not working. I love it when I get this 16-year-old girl that comes in and she's got a couple autoimmune that they've just been diagnosed with and they haven't really even started anything yet, but the mom was referred to us by somebody else that had miracles happen working with us. And it's like, hallelujah, this is amazing. Let's help this little girl figure out why her body's going haywire and prevent it from getting 31 years down the road where she's an absolute mess and can hardly function, couldn't have babies, had miscarriages, now can't walk, blah, 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 this whole gamut. And that, when that time comes, this is what really inspired me about Robert Kennedy's speech is that, this is his absolute passion, is to work on prevention and work on this early stage of childhood. And we see childhood autoimmune all the time now. Not just type 1 diabetes, but we see pretty much anything and everything that comes in adults. We're seeing it in kids now.
I know you've talked about the immunosuppressants. Are there any benefits to them?
Sure. If somebody is in a crazy high flare and they're like, they might not make it. Because again, autoimmune is the third leading cause of death when you lump them all together. And you're like, they might not make it. Well, we better do something. Calm some things down. There's probably no amount of turmeric that's going to have the same effect as going on prednisone for 6 weeks. Occasionally, there is someone's in such a bad place and in such a flare that they've got to calm it down a little bit and try to prevent damage. That none of those medications are long-term solutions.
That's what happened to me. When I was first diagnosed, I was going to a doctor. He was like my primary care. I saw him every day because he couldn't figure out what was wrong. And he tested me for everything, but everything came back negative. But he didn't want me to, I guess, just stay at home. I would get fluids, like he'd give me an IV every day.
Yeah.
Afterwards, I come back the next day looking for results from a test. He still couldn't think of anything. He didn't refer me to someone else. He didn't say, I need you to get a second opinion. Nothing like that. In fact, I started to get worse. And my boyfriend at the time took me to my sister. And my sister made some phone calls and found a rheumatologist. So I got the big dosage of steroids from the beginning. And that's when, because they were working, I've tried Imuran, I've tried Cytoxan, methotrexate, Benlysta. I've tried a lot, but nothing seems to work except prednisone and Plaquenil.
And define work. That's what you really have to be thinking about is what's the outcome that somebody is looking for with one of the medications.
When I say what works, I'm functioning. I have a regular, normal life. That is just me having the strength just to get through. I still hurt. I still have symptoms. I still have issues. I just suppress them as much as I can and just keep going because I feel like this is my life. This is what I got to live with. So I've just been doing that until I met some folks on the internet and they're talking about gut health. You may have a leaky gut and what diet and nutrition plays. And it's like, okay, I needed to do more research. And that's what I've been doing. And that's one of the reasons why I started this podcast. I want to find out what's best. I may not be in the position because I've had it for so long. So you're right. But what about somebody brand new being diagnosed? What if I can help somebody else who asking questions like I did? What's the cure?
Yep.
That's what I want to do. That's what I'm trying to help someone.
And it's, again, the outcome of any of the medications is to suppress symptoms enough to somebody can function.
Mm-hmm.
But here's what happens is none of those drugs that you've been on have helped you keep your blood sugar stabilized 85 to 110 all day, every day, all night, every night. And you have no idea what your blood sugar is doing. You have no idea if your blood sugar is spiking up, if it's crashing down, where it is throughout the day. And we know each time it spikes, each time it crashes, you rev up the cytokine response and you destroy more tissue. You have no idea what your leaky gut is doing and what your microbiome is doing. And you may not even know where your vitamin D is. And even if you do, they're going to say 30 or 40 is probably good. We need it up at 80 to modulate that cytokine response. And then we look at all these different things. So that's where the patient needs to advocate for themselves. It's not with the rheumatologist. You don't advocate for yourself with the rheumatologist because they don't have anything to do differently. If you're like, hey, I really want this other thing, or I want you to dig deeper or whatever, they don't have anything else to dig. That's it. And so you have to advocate for yourself, whether that's listening to podcasts, whether that's searching on TikTok. That's where most of our patients find us is they're searching. They don't even Google anymore. They just go on to TikTok and watch and watch. And so that's what needs to happen is people need to advocate for themselves that way and then find people like us at F8 where we will take people by the hand and say, you know what, we're going to calm down this cytokine response. I don't know if somebody's going to walk again from MS. I don't know if their lupus will be 100% gone. I don't know if the joint pain's going to go away with their rheumatoid arthritis 100%. But what I do know is we're going to do more of the good stuff, less of the bad stuff. We're going to calm down the cytokine response. We're going to fix the systems that are driving the cytokine response. And at the end of that, somebody's going to be feeling way better. And I don't know ultimately what it looks like, depending on, has it been 31 years? Has it been 31 days since they've been diagnosed? I don't know. All those factors come in. But this is literally the only way that people can get true healing. We've seen people heal from a lot of different autoimmune diseases, but here's the sad part. I've never had a specialist, endocrinologist or rheumatologist, a neurologist, anybody, that they had a patient that worked with us, their ANA went to neutral, their Hashimoto's markers went to neutral, their rheumatoid factor went to neutral, their C-reactive protein came down into the optimal range. They had no more symptoms. They felt amazing. They got their life back. I've never had a doctor reach out and just ask, hey, out of curiosity, what did you do? I've never seen that happen with a patient before with the drugs we've given them. What'd you guys do? Never have I had a doctor reach out and say that.
And you probably won't.
I hope and pray every day that we can get into those people's minds that have the power in these situations and that we can change the state of healthcare.
The thing that fascinates me, I've been going to doctors, but no one ever mentioned my diet. And I've been on steroids. My weight fluctuates back and forth depending on how much the dosage is. But no one ever mentioned that to me. The stress, anxiety, does that lead to more sickness, more autoimmune disease? Could it cause cancer?
Chronic stress or a major stressor is going to stimulate cytokine overactivity.
Okay.
So that can do it. But think about this. If you take your dog to the vet, or somebody has a dog and their dog's got like a skin rash or having issues, allergies, whatever, what's one of the first questions that vet's going to ask? Did you change the food?
Yeah, I was about to say, what are they eating? Mm-hmm.
Yeah, what are they eating? Did you change the dog food? They're going to ask about diet. But why does your rheumatologist not ask about diet?
That's what I'm saying. No one said anything about what are you eating.
Yeah, absolutely. Well, don't say no one.
Well, yes.
Because I'm sure is that going to ask you.
That's what I said. You were like, you have the cure, and I'm thinking, okay.
Even still, it's really hard for somebody that's been, through this ringer over and over and over, even to fathom that concept. You've been inundated with, it's out there, the answer's out there, so much that, it's going to take months of you rationalizing this in your head to realize the answer is not out there, the answer is inside of you. How do we go from 2 cells to 2 trillion cells in 9 months inside of our mother? How do our arms end up the same length? How do we go and heal, after breaking a bone or major surgery or whatever? That healing potential is inside each and every one of us. And if people were empowered and told this information, that's when they're like, wow, I'm going to start looking and I'm going to start researching. And that's who we get every single day that reaches out to us. And the more empowered people get, my wife's always worried about me that I say things that might get in trouble with big pharma and some of these people that don't like to hear it. But if somebody gets diagnosed with lupus at 16, that is a life of income for that pharmaceutical company.
Yes, and if they're anything like me, there's a lot of surgeries.
Yep.
Because I've had a lot of surgeries because of the damage the medication has done.
Absolutely. So we've got surgeries, we've got drugs, we've got the annual visits, I don't know if, like American Cancer Society, the people really want a cure for cancer. It's an industry. We went to a lot of walks and runs for MS walks. I don't know if people in that industry really want a cure.
I think about that sometimes too, because cancer, as rampant as it is, you would think that they would do something different. I just interviewed a lady who has stage 4 stomach cancer, and she got it from H. pylori.
Absolutely, the most common bacterial infection in humans.
Mm-hmm. Exactly, and I hadn't really heard of it until she was talking about it, and I did some research on it. It's so common, and she went to the doctor, and she kept going, but they didn't find anything. The tests are coming back negative. So she's doing what she thinks is best. She keeps going back like, no, something is wrong. And they're like, no, it's your age. No, you can't eat spicy foods.
Yep.
And so they give you medication, send you on your way.
Yeah, I don't know where this is going to go. I hope and pray every day that more and more people are able to wake up and look outside that box and get inspired to take that self-responsibility for where they are. Because if they take that self-responsibility, then they can start that self-repair, and then they can start seeing those miracles. And then they start looking at how my body can actually work better and how it can actually start the healing process. And once you start thinking that, your questions start changing.
True.
Instead of what? Holy cow, if my body can heal and my body can function better, then what you're asking is, what do I need to do? What am I going to do to move my feet to make this happen?
Exactly. Is there a cure for hypertension, such as natural herbs and supplements?
No, absolutely not. Are there things that you can take that can lower blood pressure a little bit? Sure. But that's not curing anything. Just like, hey, I'm going to take this blood pressure medication. What happens when you stop the blood pressure medication?
Okay.
It goes right back up. So no, there is no outside cure for blood pressure. There is no outside cure. Ozempic, you've seen people taking I call it a muscle loss drug. Mm-hmm. They're taking the muscle loss drug and, for blood sugar or whatever. So let's say, that their blood sugar is better, and then they stop taking the drug, their blood sugar goes right back where it was. They lose 30 pounds, they gain 27 pounds back, 97% of their weight loss comes back. Because they didn't fix anything. But here's the thing. Can you change things? And are people able to get their blood sugar down into optimal range? Absolutely. But it's not a drug. It's not a supplement. The basic things. When we start looking at blood pressure, get your blood sugar stabilized 85 to 110 every day. Put on a continuous glucose monitor. Eat foods that are not going to spike your blood sugar and not going to crash your blood sugar. You want to start working on your liver. Make sure your liver's detoxifying like it's supposed to. I had a lady today. She had high blood pressure when she came in. We're 6 weeks in, and her blood sugar's in the 120s over 80s at this point. And she's not on medication anymore. So, again, there is no outside cure for blood pressure. There's no magic herb for blood pressure. Some things can be helpful. Again, I could sell a whole lot of supplements saying, I got these magic herbs for it. But again, fixing why somebody has blood pressure is the solution. But here's the thing, is once you take that step back and say, okay, this isn't just this genetic thing that happened to me. I have the ability to control and then potentially reverse my type 2 diabetes. That changes the entire conversation.
Okay.
Because then it's not what drug can I take, what pill, what injection, whatever. What can I do? Why is this happening, and what do I need to do day in and day out, and who is going to help me reverse this?
Okay. So what is the most important message you can convey to people living with autoimmune diseases and chronic conditions?
So ultimately, the power's inside of you. It's not your next specialist. It's not your next treatment. It's not your next injection, infusion. What's the magic drug? It's not the next lupus walk that you go on and you donate to the Lupus Society so they can do more research. There is not going to be an outside cure for lupus. And some people are like, well, that's pretty Debbie Downer. I was like, no, because it's not an outside thing. And there's no drug that's going to be like, ooh, we're going to be able to modulate the cytokines and they won't ever flare up again. And you'll be able to eat whatever crap you want. You'll be able to let your blood sugar spike all over. You're not going to need to fix your leaky gut. That chronic infection isn't going to have the effect on you. All these other things. So don't sit there waiting for somebody else to find a cure. Whether that's your rheumatologist or whether that's the Lupus Foundation or anybody, you've got to take it by the reins and say, I'm going to find the cure, and that cure is going to be inside of me. And we're going to go step by step and work through each and every one of these systems that's driving that cytokine storm, and then ultimately do the things day in and day out, the right supplements, the right nutritionals, the right mindset, the right sleep, all these things that are going to get people into that calmer cytokine state.
Okay. Well, thank you so much, Dr. Ben, for sharing your insights with us today. It has been an incredibly informative conversation, and I'm sure our listeners are walking away with a better understanding of autoimmune diseases and chronic conditions. Why don't you tell our listeners how they can reach you?
Our website is F8, the letter F, the number 8, F8wellcenters.com. And then also, if you're on TikTok, we're on there, Instagram, Facebook, any of the social media platforms. You can find hundreds of YouTube videos. I've got thousands of videos on TikTok. We're up over 450,000 followers on there. We're just always putting out content, always putting out information, and just really inspiring people to take massive action.
Absolutely. And I want to thank you again for coming on. And you have helped me a lot. I know that I'm on the right path. So thank you.
Absolutely.
Before we leave, I would like to close with a special portion of the show I call Healing Heartbeats. This is where we allow ourselves to wallow in sorrow. Give yourself 3 minutes to laugh, cry, scream, cuss, or sit in silence. Whatever you need to do to feel it, do it. Let the depression in for only 3 minutes. Once you reach 3 minutes, compartmentalize it and get back to living. This is a rinse and repeat behavior. You cannot let depression take over, because when it does, it will not let go. When someone passes away, they have the day they were born and the day they passed away. There is a dash in the middle. It's not a long line. It's a short dash. That dash represents your life. Go live in spite of having a chronic illness. Don't let your condition stop you. We are on a journey to find new ways to thrive. There's a community of support and resources out there for you. If you found today's episode helpful, please share it with someone who might benefit. And as always, take care of yourself, be kind to your bodies, and keep advocating for your health. Remember, you have the strength, the heart, and the support to continue your journey. Be safe.